Hello, guys and girls. The program you are about to hear will be both fun and educational, but it is not a substitute for medical advice. Although we are doctors, we are not your doctors.
Hello and welcome to Travel Medicine. As always, I'm your friendly neighborhood internal medicine doc, Dr. J.
Hey all, this is Dr. Santosh, pediatric infectious disease doc and a researcher.
Researcher. Ah! You
Yeah.
said the secret word!
Oh god. Now you get to drink from the fire hose.
Do you remember, what was it, like Pee-wee's Playhouse and some of those other older shows?
Yeah. I the fire hose one was a pre-racist Michael Richards on one of my favorite movies of all time, UHF, the Weird Al story.
And then Double Dare, of course. Who didn't want to
Yeah.
be on that?
Oh, absolutely. Double Dare was so good. Yeah. There was, for those of us who didn't have cable and a little bit older, Bozo, the clown. And I know you don't like the clowns, but they had similar, like, kind of pranking on the audience and that kind of a thing. And he was a nice clown.
Listen up, you Captain Kangaroo.
Yeah.
It's all a
Oh,
good howdy. It's all a good howdy doody, and well, everything's fine. Hee haw! But you can't just throw every X-Men 97 show in there without context.
yeah.
However,
I apologize for my. That was all me. Yeah.
um, but I thought this week it would be fun to go to not necessarily nostalgia itself, but an aspect of it, which of course is play and toys. And
Yeah.
there is always a good age to find some kind of toy, puzzle, or game to play
Yeah.
with.
Yeah. I am of an opinion that you should play all of your life. If there's some aspect of play all throughout going straight into adulthood, then I think you're doing well. I know that's not available to a lot of people, but I think you should never stop playing.
And so this week it is an alternate week. Have we
Oh,
done one in a while? I
I,
don't
I,
know.
it's up to us and the universe as to when a week becomes alternate. That's what people have to embrace.
But whenever we do reach an alternate week, you know
Yes.
what happens?
Oh my God. It might be one
It's
of our favorite alternate week segments.
Journal Club! Yay!
Yay! Oh, yeah.
So this one, you choose the name. We can have Docs in Toyland, Toys in Medland, Toys for Docs, Medical Play,
Call 1-800 Toys for Docs.
Docs Bop.
Da, da. Now that's what I call toys. No, we're getting off track, Josh. This is a bad digression. Let's go with Toys for Docs.
All right, so in our first story, round and round we go.
Ooh, okay.
Diagnosing malaria in the field isn't all that difficult, especially in areas when you know it's endemic, but you need a device called a centrifuge that can spin a blood sample very, very quickly. And that's so you can separate out the different types of blood cells and blood cell components from each other to see if malaria, which is a parasite that lives inside the cells, would be
Mhm.
located.
Yeah, you want to create a blood smear on a slide. The classical way to diagnose malaria is still really the best way, and that is to smear the blood onto a slide and have a very good experienced technician look in the microscope and find the parasites inside of the red blood cells, which is what they feast on when they're in there. So you need to get a regular blood smear. So you can do that just, finger prick. That's an easy one. But if you want to increase your sensitivity, you want to do something called a Buffy coat layer. And in that, you want to try to
Is
get,
that because it slays blood?
yeah, yeah, yeah. But, cheerleader by day. So,
Catalytic enzyme by night.
there you go. So yeah, we need that Buffy coat, and if you're able to look at the thick and thin blood smears and the Buffy coat, then you have the best chance of catching malaria if it is in that patient's bloodstream.
Well, detecting.
Yes.
Like the patient has already caught malaria. That's the problem.
Yes, yes. So you're trying to make an accurate diagnosis.
So most centrifuges are pretty bulky, require electricity, and are expensive. And
Yes.
because of that, a lot of hospitals just don't have easy access to this technology. And frequently it's the ones in areas that would need it because they do have a lot of blood-borne diseases.
Yes, that is true.
So, researcher Manu Prakash, a professor of bioengineering at Stanford, was out at a clinic in Uganda and saw their centrifuge, this, super fancy, expensive piece of equipment, just being used as a doorstop. And
Oh
he's like, oh.
no. Okay. Oh dear.
So he set out to create a cheap, easy solution. And he was qualified to do this because he had already invented the $1 foldable microscope for
Oh.
researchers who were too scared of using the expensive equipment lest they break it.
Yeah, essentially, do you remember for a little while there were those weird Google glasses, which were cardboard with some embedded lenses, and you could put your phone in there and you could make like a VR type of a headset? Well, this was a lot simpler. He put the lens in a little foldable cardboard shell, and then you could just kind of fold it up. And the lens were relatively cheap plastic. They wouldn't last too long, but you'd have a working microscope for a while.
So in this case, researcher Prakash and his team started to experiment with yo-yos, but they didn't spin fast enough to work as a centrifuge. They were, what, like 400 spins a minute? Rotations
Uh,
per minute?
yeah, it was. Yeah, we need to get something north of 100,000 RPM type of a thing. And we were dealing with yo-yos getting orders of magnitude lower than that.
So, for example, a Formula One race car is about 15,000 RPM, whereas a yo
Yeah,
yo is 400 RPM. So, you need to
yeah.
find a nice, happy balance.
I think if
Um,
you have a hell of a wrist, like if boom, you could get to 1,200 RPM, and that would give you 300 G's of force, but not nearly what.
so, are you familiar, Santosh, among spinning toys? I feel like it's a Family Feud episode. What are the top three spinning toys? Survey says.
Spinning toy. So a top. I know about a top. Um, if you go big size, those horrible merry-go-rounds we had in our childhood playgrounds that you'd put your little brother in that thing and just whip it as fast as you could, and they'd go flying off the side. And then I would go to the science museum and I would buy another spinny toy called a gyroscope. You'd thread a thread around a central axle, and then it would loop around, and then you'd have an outer cage essentially, and then you would yank that thread as fast as you could, and the middle was spinning, and it would be a gyroscope, so that while it was spinning it would stand up on end, because of the gyroscopic forces. So I
Okay,
remember
nerd.
that one.
But for people who don't know gyroscope, it also was referred to as a whirligig.
Oh, yeah, there were early gigs too.
You continue the spinning motion by alternating the string from one side to the other.
Oh, that one. So,
So the toy is made of a disc that spins when you pull on strings, a pair that pass through the center, and it
got it.
spins way faster than a yo-yo, clocked at around 125,000 revolutions per minute.
Oh,
That is the
nice.
fastest rotational speed reported for any human powered device. Remember that Formula One race car?
Yeah.
Puny 15,000 RPM. Child's whirligig 125,000.
Well, to be very fair, the whirly gig is a lot lighter, and it
It's
is
less
it.
likely to turn over and explode. Fine, I get it.
Well,
It's
I was going to
made
say
out
it takes less force to get it to spin fast.
it's made out of the paper fuge, great
Okay.
name. Made out
Ooh.
of paper coated in a polymer film that makes it extra strong, along with string and PVC pipe. Blood
Oh.
samples
Okay.
are attached to the center disc, and then
Okay.
pulling the strings causes the cells to separate, just like the more expensive electrical version. Uh,
Oh,
you then
cool.
can you then can process the blood, test it for parasites. It can be made with a 3D printer, over 100 in a day at about 20 cents a piece.
Ooh. Oh my gosh. That is fantastic. And so you do have to have an operator though, right? Because you use it like a whirly gig. So you have to have someone standing there after you build it, and then you attach all your vials to the outside, and you have to play, like you have to spin it for however long you need.
Hey, you kid, what are you doing for the next half hour?
I
You want
don't
to play
think
with
you
this?
I don't think you need to spin it for that long. It may be something on the order of 10 minutes in order to get the separation you need into the three layers of blood that you'd like to
Just just a line of children at recess
get.
performing science.
Erythrocyte layer, the red blood cell layer on the bottom, the plasma layer on the top, and then the buffy coat, which contains white blood cells and platelets in the middle. In order to get those fractions so that you can study them, that's what we need to get.
Building on to our toys in medicine theme, I should say. What is everyone's favorite Danish toy that can absolutely destroy your foot in the middle of the night?
Oh, yeah, clogs. Absolutely. They hurt like hell. I don't care what people say.
I was going for Lego, but I think we've learned something about you today.
What? I mean, okay. Sorry. I thought we were striking out at things that have wronged us. Yeah, Legos, yes. They destroy feet to such a degree for those of us, especially who are parents, late at night, that Lego slippers have been developed to protect one's feet against the scourges of the Lego brick on the floor.
Hey kid, I need you to scatter these Legos for science.
They're like friggin' caltrops. You know when Josh, when we used to like we watched ninja movies, and ninja would be running away, and they'd throw these spikes on the floor so that their pursuer would land on and then the ninja would run away. Like that's the same thing, but like Legos.
To try to prepare children for entering an MRI machine and to lower
Oh,
their overall pre procedure anxiety, Lego has released a special MRI replica set to hospitals. So
oh,
the scanner model is to be distributed to hospitals around the world. One part is an open MRI scanner able to demonstrate how real MRIs look and function, and then a second room showing the radiologist where the scan results are read.
oh, so they have a whole setup like a radiology suite.
Did this study with 125 children, ranges 8 to 12. Some got the Lego set, some got board games, some got videos, some got booklets. Anything interactive where
Okay.
the kids could feel in control made them more likely to comply with the procedure, less likely to be scared of it.
Got it. Okay. We use this a lot in pediatrics, some sort of a simulation tool, and we found them very, very useful. For instance, children who need to get gastrostomies, so a small catheter which goes straight into their stomach from the skin because of difficulty eating or anything like that. We actually will show them how it looks on a little teddy bear or a doll, and that makes them relate to it and understand what's going on and how to take care of it. So this is kind of in the same vein.
So this is a very far offshoot of Lego's Prescription for Play program,
Okay.
which mostly is provided to primary care physicians during wellness exams to promote play in children 18 to 36 months. So
Okay.
it offers free bricks for any care teams for their patients and caregivers. But children are not the only one benefiting from playing with Legos. You know who else
Get out of
does?
town.
You know who else
Sorry.
does? Well, aside from everyone,
Are you educating the parents?
anesthesia residents.
What are you going to do? Are you going to show them what true pain feels like? I want you to sympathize with your patients.
Oh, I'm sorry. Would you rather do that one first? Because that's what they're doing in emergency medicine and internal medicine residency programs,
Or
or
is
medical students, where they learn to communicate by pairing up with one person getting an assembled Lego structure and
okay.
another getting all the pieces, and neither one can see
Oh,
the other,
oh
but you
my,
have to teach them
yeah,
what you are doing. Now, for internal medicine medical students,
yeah.
or for that section, it's done to teach how to take a patient history, learning to ask open ended questions to get information beyond yes, no, etc.
Oh, that's
For
so cool.
emergency medicine, it's used to explain how to do procedures. If you can teach someone to build a Lego, you can probably teach them how to do a lumbar puncture. That is either impressively difficult for Lego, or I feel unfairly overestimating the easiness or underestimating the difficulty of a lumbar puncture.
No, I'll say I do teach lumbar puncture for people who are doing lumbar punctures on children, diagnostic lumbar punctures, and we have simulation dolls. And there are times, based on the medical student or the resident's ability and their choices and stuff, there's sometimes where I can hold a hand and I can guide. But there are other times where I have to describe what's going on, what the person's going to feel, etc. And even with the doll there, the simulation mannequin, you do have to find a way to describe a sensation, like communicate what it should feel like without being able to directly show what something feels like.
For example, stepping on a Lego.
I was imagining that like that would be the final exam in anesthesia. That like
Oh,
you have passed all of your tests. Now you must walk across the field of Legos in Barry. And it's just, anesthesia
so
residents like, ha, ha. And then,
back to our anesthesia residents.
yeah.
Ultrasound guided regional anesthesia
Okay.
is when anesthetists inject local anesthetic medications around specific nerves to provide pain relief after surgery. So it's very, very localized pain relief. Now, how do you single out a target nerve? You use an ultrasound machine to direct injections into the correct position without hitting other areas you don't want to.
Gotcha.
So currently, this relies on extensive practice on expensive simulators.
Yeah, this is a simulator mannequin that would have to be very specialized and complex and probably expensive to build, and use an engineer and stuff, because you're setting up a very specific anatomy that's pretty hard to simulate.
So researchers developed a task where people copied shapes using bricks only that they could see in a two-way mirror.
And
So
it
this,
okay.
meaning what do things look like in a mirror? Reversed, possibly closer than they appear.
Oh, got it. So they couldn't look at their own hands and the bricks. They had to look in the mirror.
Well, the finished product they were supposed to copy. was out
Got
of
it.
sight in the mirror. They could watch their own hands. But
Oh, got it. Okay.
so this was used to train the doctors to maintain the patience and understanding of 2 and 3 dimensional objects. So the objects were pre-made, giving them a view of what the object had to look like. You
Right.
would then recreate it to exactly match. And this was done using Lego Duplo building bricks until perfect. So if they looked at it, you know, Top Chef or reality TV show style and said, nope, send it back, you're
Yeah.
still missing this or that.
Oh, okay, gotcha. So they got feedback and then go, fix whatever you needed. I love that they use Duplo instead of the little Lego. So they got the big, gigantic blocks for the 2-year-olds.
Of course, Lego is also being used to teach that same spatial and manual dexterity, along with instruction following in patients with Parkinson's, in patients with Alzheimer's.
Wow. Okay. This is so cool. So you're teaching, proprioceptive coordination kind of a thing. You got to feel where things go.
So,
Oh,
building Lego sets really is great for all ages.
I'm telling you, man. The one thing though I gotta say is they gotta drop their prices a little. Holy crap, Josh! Recently, like if you want to therapize with a Lego, you're gonna need some insurance. Um,
Or that's how you justify having the stroke. No, you don't understand. I just really wanted this set for
yeah.
therapy purposes.
Oh my gosh, wild. I'm looking at these sets. These are really, really cool. They're all isomers, so they have to match and make sure that there's isomer structures which are mirror images kind of a thing, but you don't want to do that. You want to look in the mirror and say, oh, no, no, I have to build it to look the same way as it would be, without the reflective part of it. So you kind of have to spin it and reverse it in your head. So you're doing spatial reasoning on the fly.
Did you know that one of your favorite children's authors was also responsible for a pretty significant advancement in neurosurgery?
uh is this something like Michael Crichton, who was a doctor, or something
Nope.
like this? No,
No. Don't be ridiculous.
is it
It
Dr.
was
Seuss?
closer, but not quite.
Okay.
If we move across the pond, you get Roald Dahl and the giant hydrocephalus.
So Roald Dahl. Okay, so Charlie and the Chocolate Factory, Willy Wonka, the BFG, Matilda, the Phantom Toll Booth. Very.
No. He was not Phantom Tollbooth.
Oh, he wasn't. Oh, sorry. I always relate him to Phantom Toll Booth, but that's a different writer. But yeah, BFG for sure. So yeah, did fantastical, beautiful things. Sometimes to describe things in his own life, but in a fantastical manner. Sometimes to teach lessons, and other times just to kind of mess around. I believe he's responsible, kind of like Shakespeare, for creating a ton of words too.
So
Wow.
most physicians know Roald Dahl from 1916 to 1990 because that's when he lived. It's really
Oh,
difficult to know him outside of those dates.
yeah, sure. Wow, he lived a good long life. Okay, nice.
So while living in New York in the 60s, his 4-month-old son, Theo, was hit by a taxi and suffered traumatic brain injury with multiple skull fractures, brain swelling, and brain
Oh,
damage. Now, he
oh,
survived, but he
okay,
developed a condition known as secondary hydrocephalus. You have
got it.
4 wells of cerebrospinal fluid in your brain. Think of it like little reservoirs of uh, brain cushioning. That's not what it is, but that's how you can think of it.
Sure. So yeah, cerebrospinal fluid will circulate around the outside of the brain, to provide a cushion between the wall of the skull and the brain itself, but then to prevent compressive forces, to stop the brain from basically squishing inwards. There's also a circulatory pathway of two large lateral ventricles, that are kind of on either side of the midbrain, and then a third and a fourth ventricle which go down the center, and then those drain down, the spinal cord and everything. So the cerebrospinal fluid makes this big path of circulation and then gets resorbed in the arachnoid mater, the one of the outside coverings of the brain.
Now, in certain kinds of brain injury, those little wells full of cerebrospinal fluid can enlarge and press on other still working parts of the brain, causing further injury. So you basically put a shunt in, like you would, I don't know, tap a barrel in a bar or put a straw into a boba drink. I don't know.
Yeah.
Is there a more uncomfortable way to think about it?
No.
There may be.
It is. It's essentially a complex straw. You thread a catheter into the ventricles to allow for the cerebrospinal fluid to go out a different way when the pressure builds up too high, and then you thread the shunt through. I know this sounds scary, down the neck and then into an internal structure in the body so that the CSF can circulate. And it doesn't matter, it's one of your body's fluids, so it can get resorbed and recycled a different way. A lot of the time in kids, we send that catheter all the way down the inside of the chest and down into your abdomen, into the peritoneum.
Now, the older versions of these catheters would often get obstructed, leading to hospitalization. You basically have brain fluid backing up and nowhere to go. So Roald Dahl, noted children's author, was determined to find a solution to this problem. He was a concerned parent. So he contacted good friend Stanley Wade, a toy maker who specialized in making small hydraulic pumps that supplied fuel to model airplane and train engines. Again, a hobby of Dahl's.
Yeah. he was basically just reaching out, and you can kind of imagine the desperation of a dad where his son is okay and then this thing would obstruct. The cerebrospinal fluid, Josh, is not just water, right? It there is actually still debris, and if the brain was injured, and there's fibrinous material that's created and then shed, it'll clog up this system. And you can kind of imagine how scary it is that, like, your son's doing fine and then boom, it gets clogged, and an hour later he's sick. You have to go back in. It has to get maybe redone, have another surgery. Like, it's a scary, scary thing to watch your kid going through. So he just said, all right, well, medicine doesn't have a solution. Maybe there's a solution somewhere of fluid going through small pipes and needing tiny valves.
So Roald Dahl, noted children's author,
Yeah.
and his friend Stanley Wade, maker of planes, trains, and automobiles.
Tiny planes, trains.
Tiny trains, planes, and automobiles.
Yes, yeah.
Went to Theo's doctor, pediatric neurosurgeon Kenneth Till, at the Hospital for Sick Children at Great Ormond Street in London. Just as a fun aside, that's the same hospital donated by J.M. Barrie. That's the same hospital first built at the behest or inspiration of Charles Dickens. It is a hospital with a lot of history.
Oh, nice. A lot of literature history. It's like this place seems to
Roald
be built
Dahl, noted children's author.
Okay, yeah. Oh, yes. And his friend Stanley Wade.
In literary supported and founded Hospital for Sick Children and pediatric neurosurgeon, eventually created a brand new kind of shunt that I believe is still in use today, the Wade Dahl Till shunt. Oh, look at that. It's got all of their names.
Yeah, this was it was essentially the valve that you can't just have an open tube from the cerebrospinal fluid to your peritoneum, because then the drainage of the CSF will be unchecked. It'll and the tube itself can get clogged up. So you need a mechanism to actually control the flow of that CSF, and essentially a tiny valve type that would control the flow of fuel through teeny tiny pipes in a toy airplane or a toy train was the perfect kind of model to build this on. So this was the valve, Josh, that went inside of the shunt. The shunt materials and such over time have been upgraded and changed and all this kind of a thing. But this type of Weydal till valve works beautifully. It was taken into production in 1962. It's been used in 3,000 children worldwide over the next couple of years. It did become superseded by new types of valves, but 3,000 children, Josh.
Using a brain plug to prevent cerebral debris, stainless steel rather than unsterilizable plastic, so it was cheaper. So yeah, that's that is a fun. It's a fun story.
It's it's really beautiful. I do want to give a shout out for one of my favorite YouTubers, Kevin on Vsauce too, where I saw it's a beautiful video that he's made regarding this subject. After you're done listening to us, you should go see it. But it was the inspiration for me asking Josh to research this topic, and he found this beautiful paper, which he'll link below.
We have supply chains around the world. Some of
Okay.
these are very efficient, and some of them are very not.
Like a broken valve in a ventricular peritoneal shunt, which needs to be replaced.
Or like healthcare in general. Terrible supply chain issues. Things take forever to get anywhere. They aren't widely distributed, but you know what is? Toys. Because the latest toys are always out faster than the latest medicines.
It's true. All of us who've been living in the United States here over the last 2 years, 3 years, we have seen supply chain blocks for vaccines, for antibiotics, all kinds of different types of medications. And then, of course, Josh, at the beginning of the pandemic, medical supplies such as masks and other personal protective equipment, because the demand just outstripped the supply, or logistical issues just couldn't bring stuff over fast enough from where it was made to where it needed to be used.
So, researcher Jose Gomez Marquez
I love that
MIT's
name.
of MIT's Little Devices Lab
Little device
is working to come up with creative solutions to modern problems, such as looking at creating a inhaler that uses pieces similar to toy helicopters. Just flappers that beat powder into small clouds.
Nice.
Or medikits that teach you how to improvise either lab tests or medical solutions out in the field for cheap prices.
Ooh, yeah, very nice.
So while these stories are just a small example of what can be accomplished by repurposing toys, I'm sure there are many more out there we'll continue to learn about. However, I think it's also important for us to note, how long do infections survive on toys? This is what all the siblings of the world can listen to and be like, see, I told you I shouldn't share.
Yeah. Yeah, so if your baby brother or sister with a horrible wretched cold and snot everywhere drools, would you rather have them snot all over your Legos or your Barbie? How long would the Barbie and the hair and the face and the clothes hold on to this horrible cold virus versus the Lego? And how easy would be to clean it off, one versus the other?
Right? People don't really think about getting viruses from inanimate objects. They think
No.
about getting them from other people, aside from the ever popular urban myth of catching, various diseases from a toilet seat.
Yeah, that's true. Toilet seats, it's pretty hard for a virus to live on there for any period of time, because as long as you wipe it down, it's a dry surface. But cold viruses, not coronaviruses, but RSV and a few of the other rhinoviruses and stuff, they have these neat little adaptations to linger on surfaces for a longer period of time. They're smart. They've evolved these methods to say, all right, well, if I can't go person to person, I'm gonna just sit here on this table until somebody else comes by and touches it and picks me up and then touches their eye or their nose or their mouth.
So, over at Georgia State University, researchers tested how long an enveloped virus could survive on pieces of a flexible plastic children's toy, in this case, a squeaking frog.
Yay! Yeah, the lipid envelope is exactly what I described. So that's the it's an outer layer. Not all viruses have them. If you don't have a lipid envelope, then it's harder to survive out away from a living host. It also takes energy to make, but it creates a transmission advantage.
They were then able to recover infectious particles from the toy up to 24 hours after the toy's contamination,
No. Oh,
as
God.
long as it was 60% relative humidity.
Okay.
However,
Okay.
even at 40% relative humidity, they could still recover viral particles at 10 hours.
Okay.
So, what does that mean, Santosh?
So now it really doesn't take that long for like one kid to finish chewing on a rubber toy and then put it down and for somebody else to come along and pick it up. So essentially what that means is for these specific enveloped viruses, not all, again, for the viruses that they were testing, it means that in an environment like, for instance, a daycare or a preschool or even like a home nursery where you had multiple kids, it would be almost inevitable that a child would transmit this virus from one to the other without needing child to child contact because there would be such little time between passing from one person to the other versus how long this stupid virus can actually live on the surface of the frog. um
So, yeah,
yeah.
basically long enough to result in exposures from viruses like Middle East respiratory syndrome, other coronaviruses, not
why'd
just
you have
COVID 19,
why'd you have to pick that one?
influenza.
There you go. Yeah, I mean
Listen,
it's
I don't know where most of our listeners are other than Australia.
well, yeah, but unless MERS, unless they're hanging out with camels.
I
It's-
don't know I don't know what you do with your life.
am I the one being judgy here, Josh? Is that how we're doing this out?
Look, there has been viral contamination of shared toys in daycare, doctor offices, homes, uh,
Yes.
and you don't know where people are coming into healthcare settings from.
Yeah.
I just feel that while maybe not top biller,
Yeah.
certainly deserves a spot on the marquee.
Sure. Now, I will say that's pretty good in terms of like a drop off, in terms of the humidity that you quoted, the survivability of the virus. It does mean that, not even with, using a Lysol spray or something like that, if you took the time to just dry off that toy, um, you'd probably have a much better chance of stopping circulation of an enveloped virus. So it doesn't take much to clean. Soap, water, and then drying would be just fine. But you
Not
do
to
have to do
mention,
it.
not to mention that this is only the most extreme, the 1% of the viruses,
Sure.
because in the first 2 hours, only about 0.01% of the virus remained. So 99.9% reduction. But
Right.
that last bit that hung on could still cause
Yeah.
exposure and infection.
That's the problem. So that's the other nonsense with all the like the Lysol and crap, right? Kills 99% of well, that's still a hell of a lot of germ, sitting on there, and it's perfectly transmissible. So yeah, I would not recommend Lysoling everything.
And now
Just
your hands are just drenched in soggy, drunken germ
yeah.
corpses.
Gross. Yeah, just dry them off. That's all you need to do is just dry off the toys, and if you're able to do that I'd say every hour or so, Josh, in between play, you'll cut down on the transmission of those surface surviving viruses quite a bit, and save some snotty noses.
So that's it. Hopefully, we showed you how to play again and then took away your desire to do so
Yeah.
with toys.
No. I hope it sticks around for a really, really long time. Your love of play, and see, it can turn into innovation, and making things accessible to places where it wouldn't be, like the centrifuge, and solving things like logistics, and then even figuring out how long a virus lives on a snotty frog.
So take heart, take hope, and take a break.
Give me a break. Oh yeah.
So that's it for this week. As always, we love to hear your comments, questions, and feedback. If you'd like to support us spiritually, emotionally, or financially, links to do that are in the show notes, along with links for further reading. And if you've heard of any other medical uses of toys or toys turning into medical devices, give us a shout out.
Yeah,
We are
we'd
on
love to hear
all the
about
social medias, mostly.
it. Yeah. When we
Also
get
in
the
the show
shits
notes.
do it again. Do it again. You're loopy.
Um, if you'd like to support us spiritually, emotionally, or financially, links for that are in the show notes, along with links for further reading. Our
Ooh,
theme music is
Josh, do you think in like the next Toy Story, like Toy Story 5, it'll be like Buzz Lightyear becomes a study platform for, spatial reasoning in a MIT lab?
Toy Story. That's what this episode should have been called.
How did I just come up with that now?
Until next time, as always, keep a song in your heart, soap on your hands, a shot in your arm, a spin on your globe. When you've done all of those things, look around, find a toy to play with, throw it in your suitcase, and happy travels.
Enjoy, everybody. You are a toy!